So when you do a breast augmentation, you don't just talk about the size of the implant. You have to talk about the profile of the implant. And with any given implant, there are low, moderate, high, and extra high profile implants. So if you look at these implants, this implant has more projection versus this implant that is flatter. So the way you go about deciding that is really based on the patient's anatomy and their desires. Some patients want a very natural appearance, so they don't want an implant that projects a lot. And so with that, you might use more of a moderate profile implant. If someone wants a really round appearing breast, you'd use a higher profile implant. And then the patient's anatomy also plays into that. So if you have a very narrow chest wall, you're going to use a little bit more of a narrow implant. If you have a wide chest wall, you're going to tend to use a wider implant. If you're going to have a breast lift and put an implant in, often I'm going to use a lower profile implant because you're lifting the patient's own breast tissue, and that will kind of cover that breast. So there's a lot of factors that go into deciding the type of implant. I would say that most patients will come in, especially the younger patients, and they'll have an idea, oh, I want a high profile implant. As the older patients often will just say, hey, do whatever you think is best.